Bismillahirrahmanirrahim. Hello everyone, welcome again to Ziada Academy. And today I will complete my speech about the venous red eye with this very important topic, which is blepharitis, one of the common presentations in our clinics. Blepharitis means inflammation of the lid margin, either including the eyelashes or not, but the anterior lid margin or posterior lid margin. So we have two types of blepharitis, anterior blepharitis or posterior blepharitis. So blepharitis is defined as I said now, inflammation of the eyelid margin, which results in obstruction of grease glands, which is the meibomian glands, which leads to ineffective tears that evaporate easily. This causes the eye to water as a response in this dryness, which is typical symptoms of excessive watering, irritation, and redness. Signs on clinical examination of the blepharitis: you will find irritated margins with capping of the orifices of meibomian glands, which is called little globules, crusting and matted eyelashes. It's in case of scaly blepharitis. There is crusts, as you see now in the photo on our left side. There is dried crusts at the bottom or at the bottom of the eyelashes, at the part of the eyelashes meets with the lid margin. You will find crust, which is strongly adherent to the eyelash and lid margin, so it's not easy to discard it and to remove it without wetting, without trying with other solutions to make it easier to be removed, without leaving scars, without leaving wounds or multiple wounds at this part of the lid margin. It's also calisions. Calisions is a part of the posterior blepharitis due to obstruction of the meibomian glands with accumulation of the sebaceous materials inside, which may be infected or non-infected. The calision appears as a lump on the eyelid, resulting from the accumulation of secretions in the tarsal glands. Management options for blepharitis include good lid hygiene and warm compresses with lid massage to help clearing the debris which is built up. Ocular lubricants, thin preparations through the day, and thicker ointments before bed. In severe cases of blepharitis, occlusion of the pancta is used to reduce tear drainage and improve overall ocular lubrication in case of associating significant dry eye. So the types of blepharitis they are very crucial to know, to define the way of management. Scaly blepharitis, as shown before, and this image above, and this photo above, it's called seborrhea. It's commonly presented in the winter, but we may find it in other seasons. It's characterized by this sticky material, which is adherent to the anterior lid margin with the lashes. They are crusts, so they may leave one behind if they are removed forcefully. It may be associated with dandruff in the hair and the scalp hair. So it may be associating a sign with each other because they have the same mechanism. The second type is ulcerative blepharitis. It's bacterial or fungal blepharitis, but it's a very insulting type of blepharitis because it's associated with multiple ulcers in the late margin. So the treatment of the scaly blepharitis will be with using the lubricants, with using the vitamin A in case of the vitamin A deficiency. Also the boric acid solution to make it wet and easier to be removed with use of the hot foments as well. And the correction of the predisposing factors, as I mentioned before. The ulcerative blepharitis is treated with the antimicrobial ions on these parts of the lid margin. And the angular blepharitis is the third type of blepharitis, and it's characterized by infection of the Moraxella, Axenfeld, and staph microbes. They are related to the angular blepharitis. The parasitic blepharitis is called Demodex folliculorum. It's a type of the parasites which is commonly present in the very in the areas with very low hygiene, and you will find it, maybe you may find it once or twice at most in your life if you are not working in such areas. It's treatment of these types of parasitic blepharitis by removal of the eyelashes to remove the container or reservoir for these parasites. So you will help discarding these parasites also with the anti-parasitic drugs, according to the recommended drug for this type of parasite. The angular blepharitis is treated with the antibiotic, which is specific for this Moraxella Axenfeld. Also by the zinc ointment, which is not available today everywhere, but it was recommended to use it in cases of angular blepharitis. So after completing the series of the painless red eye, we have to think to diagnose and to differentiate these causes from each other to give the proper treatment for each one. Thank you so much, and I will see you in the coming series, which is the painful red eye, to complete the causes of the red eye, either painless and painful, and finally we will compare each types together, each type, both types and both causes together to help thinking and do differential diagnosis of the different kinds and different causes of red eye. Thank you so much, and see you in this series. Bye-bye.